Hi everyone, thank you for coming today. As some of you may be aware, my name's Jade. I'm here to talk about our case plan. Firstly, I'll get into it. It's about a girl, Nola. She's a 6-year-old girl who has recently been placed in foster care. Prior to her entry into foster care, Nola has been living with her mother, whose name is Jenna, who has been using illicit substances. They were mostly considered to be homeless, staying with various friends, and Jenna was using prostitution to fund her addiction. Nola has had limited socialisation with other children. She commenced school this year. However, the school has reported ongoing issues with poor impulse control, difficulty negotiating rules of play with other children, and stealing food from others' children's lunchboxes. Nola appears to struggle with attending to instructions and following tasks in the classroom. So how we're going to look at her with case plan is with the theorist Erik Erikson. Just a little bit about Erik Erikson. He was a German-American developmental psychologist and psychoanalyst known for his theory and physiological development of human beings. He was born on June 15th, 1982 in Frankfurt, Germany. He never received any formal degree in medicine or psychology. While studying at the Das Gymnasium, he was primarily interested in subjects such as history, Latin, and art. He got a teaching position at a school created by Dorothy Birmingham, which is a friend of Anna Freud's. Freud also soon noticed that Erikson's rapid rapport with children and encouraged him to formally study psychoanalyst. Erikson ultimately received 2 certificates in Teachers Association and from the Vienna Institution. So this is just the stages which he came up with, which I'll go into a little bit. So trust and mistrust is the first stage. This stage begins at birth and continues to approximately 18 months of age. During this stage, the infant is uncertain about the world in which they live and look towards their primary caregiver for stability and consistency of care. Stage 2 is autonomy versus shame and doubt. The stage occurs between the ages of 18 months to approximately 3 years. According to Erikson, children at this stage are focused on developing a sense of personal control over physical skills and a sense of independence. Stage 3 is initiative versus guilt. During this stage, children assert themselves more frequently through direct playing and other social interactions. Stage 5, industry versus authority. Children at this stage, where they will be learning to read and write, to do sums, to do things on their own, teachers begin to take an important role in the child's life as they teach the child specific skills. Steps. Next step is identify versus role confusion. So this is the 5th stage and it occurs during adolescence. So say from about 12 to 18 years old. During this stage, adolescents search for a sense of self and personal identity through an intense exploration of personal values, beliefs, and goals. So the 6th stage is intimacy and isolation. This stage takes place during young adulthood between the ages of approximately 18 to 40 years. During this stage, the major conflict centres on forming intimate, loving relationships with other people. The next stage is generative versus stagnation. So this stage takes place during the middle adulthood, which is ages 40 to 65. And the final stage is ego, integrity versus despair. This stage begins at approximately age 65 and ends at death. In this time, that is when we contemplate our accomplishments and can develop integrity if we see ourselves as leading a successful life. So that was just a bit about the stages. So let's go into what I've come up with here. So there was a question saying, document potential questions you could be asked of the client or their family to obtain relevant information. So what I gathered is that we would ask Nola's possibly caseworker if Nola has seen anyone else before, if Nola has ever played any sports, and has Nola had much interaction with other children. We know that she's had limited interaction, but maybe just getting a better understanding of what interaction she may have had with children previously. Then we go to the next one, which is identifying your client's developmental status in relation to this theory. So Nola's not having interaction with children, which will be Nola has not been enrolled in any type of schooling, therefore has missed Erikson's third stage, which is where children assert themselves through play and social interaction during this stage. The main feature involves that the child interacting with other children, as it gives them the opportunity to explore their skills. This is something Nola has missed by not attending preschool or having interactions with other children while being in her mother's care. Then we look at another problem, which is stealing food, which comes from trust and mistrust. It's where the infant receives is consistent, predictable and reliable. They will develop a sense of trust. If their care has been unreliable, then the infant may develop a sense of mistrust. So with that, Nola being homeless and her mother using illicit substances, Nola, from what I assume, may not have been fed regularly and does not trust that when she's hungry, she will get fed, which may cause an impulse to steal food. So then we go to the next point, which is Nola not being able to follow instructions. So this goes under autonomy and shame and doubt. So that's likely to occur when the child is not given any choices or boundaries, as they are deemed independent at an early age from their parents. The strong will of a child may cause conflict between the child and caregiver. So Nola may not have been given choices when she was younger, which would cause Nola not to follow instructions. If Nola had to fend for herself also at such a young age, this will make her feel independent and cause her not to follow instructions. So then we'll go to the next point, which is to identify variations from normal development. So the points I've written here is Nola is not behaving or acting the right stages for her age. By age 6, Nola should have developed guilt and shame, which would stop her or make her aware of stealing other people's food is not acceptable. Nola should, by this age, understand negotiation rules of play with other children, which are the initiative stages. Nola should not struggle with attending to instructions and follow tasks in the classroom at this stage, as this should have started to develop from birth as trusting. Nola may have had a learning disability which may prevent her from achieving these milestones. So the next point we have here is identify potential factors responsible for variations from normal development and determine an appropriate response of terms. So a little point I've written there is Nola experienced living with her mother with drug use and homelessness. And also, Nola's mother may not have been nurturing Nola with affectionate love, care, and possibly food. So we go further down, and appropriate referral and reporting in line with organisations' requirements and or mandatory reporting requirements. So I've just written a few notes here, which could be possibly verifying all information with the foster caseworkers and inform them on all decisions that are to be made, as they are the people, as well as the foster parents that need to know the relevant information, and they're the ones that will ultimately decide whether or not what we've referred Nola to is acceptable or not. Explain and make sure we follow confidentiality and privacy. We need to comply with the organisation's reporting guidelines. We need to consider the dignity of risk. We need to look at if we suspect Nola is at harm in her foster placement. We need to classify that under mandatory reporting, which will be going to supervisor with your findings. And then lastly, with all our findings and referrals, before going to the caseworkers, we need to get your supervisor to sign off on those. So then we look at provision of appropriate services professionals. So the points I have here is refer Nola to an occupational therapist, which is an OT, which should help her with communication and play skills. Another point is child psychologist, as Nola may have an emotional or social disorders. So she may have something more to do with mental health, which is why she may be possibly her behavioural issues with instructions, not playing well with children, and possibly stealing food. And I've written that down there a little bit, which a child therapist also, because they can help Nola with use of self-control, to be patient, follow directions, listen, to share, to try again at what she needs to do, or deal with losing, and to help her solve problems, which may also help with her behavioural issues. And last and not least, need to critique the chosen theory in relation to this case study. So what I've seen and I've noticed in the strengths for Erikson's theory. So the 8 stages, you get to get a better understanding of what Nola has not achieved. His theory is once Nola has had help to fix the problems happening, then when she reaches adolescence, it will all be resolved. Successfully tie together the importance of social development across the lifespan, and descriptive overview of human, social and emotional development. So that's just a little bit of strengths there, as you can see. And then we have limitations, which is vagueness about the cause of development, not knowing cultural background of Nola, so therefore with Erikson's theory, it may not reflect her cultural background. His theory is more applicable to boys than girls, so that is a significant limitation, because as Nola is a 6-year-old girl, and fails to detail exactly what type of experiences are necessary for each stage in order to resolve the conflict, which you could possibly, further investigation could look at, and you could probably guess what experiences would be, but this, you don't really guess when you're dealing with a client, so that's the only limitations that I could see. So that's all. Is there any questions today about this case plan? Well, thank you all for coming. I hope you enjoyed this presentation. Feel free to email me if you have any questions that you think of later on. Thank you.